Before coming to the US, we recommend some testing on both the female and the male patient. For the female, we recommend for them to have an ultrasound and some blood tests to check their ovaries and their hormones to make sure they're ready to become pregnant. For the male, we recommend a semen analysis to make sure the sperm is okay. In addition, we would like for them to have a consultation if they have any other medical problems, to recommend any additional testing as needed. In addition to that, each patient should take some supplements to improve their chances of pregnancy. The supplements are also individualized, so if they like to get individualized supplements, they're welcome to contact our clinic. I'll review the history and prescribe those accordingly. The type of patient that needs to come to reproductive fertility center is any patient that's struggling to become pregnant. They've tried on their own for 6 months to a year and are unsuccessful. Any single parents and single dads or moms that want to become mothers or fathers are welcome to use our services. We currently offer IVF, intrauterine insemination, gender selection with pre-implantation genetic screening, egg donation, surrogacy, or any other type of fertility treatment. Before starting fertility treatment, it's important for the patient to do some testing and start on some supplements to improve their odds. The testing, as I mentioned before, include testing the male and the female to determine the cause of infertility. And the supplements, as I mentioned before, are supplements that are individualized per patient. This will be done before they come for treatment. The benefits of doing reproductive fertility in the US include high success rates, superior technology and methodology, and more flexible laws as far as surrogacy, egg donation, and gender selections are concerned. The combination of this makes this kind of treatment in the US superior to anywhere else in the world. The benefits of doing PGS are as follows. It checks the baby to make sure that it is genetically normal, so it will minimize any chance of the baby having any genetical problems. In addition, it checks the gender of the baby, so if you're interested in choosing the gender of your baby, this will help. And finally, it minimizes the chances of any genetic errors. So by doing that, we can implant less embryos and decrease chances of multiple gestation. A typical IVF treatment takes between 17 to 21 days to complete. Natural IVF and stimulated IVF have different success rates. Natural IVF typically has lower success rates. For example, in a patient who's under 35 who does a natural IVF cycle, her success rate is only 15%. Whereas if she takes medications to increase the number of eggs that she produces, that success rate increases to 60 to 70%. Some of the side effects of IVF medications include mood changes, abdominal bloating, abdominal pain, which in severe cases can be called ovarian hyperstimulation syndrome. All of these medications include the active hormone of FSH, which is a naturally occurring hormone in the body. We're just using it in a higher dose to produce more eggs. The good news is that all the side effects I named are transient and will pass by the time the hormones come out of the body, either when you get your period or hopefully when you're pregnant and after you deliver your baby. All our egg retrievals are done under general anesthesia with IV sedation with a board-certified anesthesiologist. This kind of anesthesia is like twilight sleep, so there is no intubation involved, but the patient does not feel any pain during the procedure. After the procedure, there may be some mild cramping, which is easily treated with Tylenol. Fertility treatments are legal in California. The types of treatment that are currently legal include egg donation, surrogacy, gender selection, IVF, insemination, and in RFC we offer all of those treatments. In closing, I've answered some of the most common questions that people ask of our clinics. If you have other questions, which I'm sure there are a lot of other questions that come to mind, please contact us and we'll be happy to answer those. You can reach us via email, phone, or live chat.